All right, hi guys, good. Looks like your presentation is in nice order. Just want to give you a little bit of feedback. The slides are very pretty, they're very bright and bold. You did a really nice job of making it nice and concise and neat. A few typos in here that I want to address. One, you have Princicap here. So go back and fix that, please. School-age children, it's actually anyone from pre-K all the way up through college is considered a school nurse. So you might want to go back and look at that. This slide, just because of the background, I think it's hard to read with the right writing. So I'm not sure if it's better to increase the size of the font or maybe just to change the background. I think it's cool, it's just hard to read. And also here, just a few things. You have an equal sign, you have a definition here. There's no equal sign or definition here. Here there's a little hash or a little hyphen, not a equal sign. So just make sure that it's nice and coordinated all the way through. Okay. Good. So that's all good there. Where's my little drag bar here? Okay. Very pretty. Okay, primary prevention. Yes. I can't see on the way this downloaded whether or not this is at least a 20 font, but make sure your font is at least 20 point in size. Okay. Okay. Yep. Good. Yes. Good. Okay. Yes. Okay, so one of your big teaching points here is going to be that for the school nurse, they really have to almost triage the patients. Or the students, they have to be able to know which ones are actually acutely ill and which ones are kind of just faking it to get out of class. So really they have to have a very good understanding of what we call the red flags, the things that we really need to be concerned about. So fevers and all of those things, an emergency like anaphylaxis would be something that they would need to be able to evaluate as well. So yes, so they do need to be able to perform CPR, first aid, all of those things. Great. Superb. Okay, so secondary prevention. Yes, they do early detection, good, vision hearing screenings. Yes, excellent. Glad you got the scoliosis, the lice, and yeah, some of them do general physical exam, but I don't think many of them do. Oh, I'm so sorry. Been a long day. Okay, so yes, child abuse is very real, and the school nurses often realize what that is. So that's good. Okay, respond to school disasters. Okay, good. Yes, okay, so you have a really good point here about the IEP or individual education plan. That is a good thing. The individual education plan is actually more how the learning needs of the student are met with a physical handicap or a mental handicap. So what you need to go back and do, please, is look up a 504 plan. Okay, the 504 plan is more of the medical plan in terms of how the school nurse accommodates for the medical challenges while the student is in their facility. Okay, so an example of this would be like a child who has asthma needs to go to needs to go down to the office for a breathing treatment at 10 and 2 every day. That actually falls under a 504 plan. So if you could go back and do some research on that, that would be good. Okay. I get the health education. I can follow that. I'm having trouble with the physical education. Are you thinking like after school, or what sort of physical education are you thinking? Because I guess my brain is kind of going to the gym teachers on that one. So I just want to know where we're headed with that. Also, again, same thing. You have your colons here, but you don't have anything after it. So to keep it consistent, put those semicolons in and then explain exactly what it is that you mean, because I'm really not sure what you're looking at there. Yes, good there. Okay, so yes, this is a good program. please go to the National Board for Certification of School Nurses. They actually have requirements that tell you what it is that you need to do to be able to get that certification. Just want to look here and check and make sure on the rubric that you had everything that you need. Please hold. I'm feeling like there might be something that's missing here. Assignments. Specialty presentation rubric. Okay. All right. Okay. So make sure you go back in here and address what is different about the specialty versus acute care. Okay. That needs to be almost a whole slide, please. So think about it. Think about, where are their supplies coming from? Where is their money coming from? Think about the downfalls that people would tell you about it. Okay. Identification. Okay. So there is significant additional training beyond the registered nurse that is required for a school nurse. Usually it has to be at least a minimum of 2 years of acute care practice, and then there is usually some sort of hourly requirement with it as well. So like for my certified emergency nurses exam, I needed 2,000 of ER practice hours before I was allowed to read that, or allowed to take the exam. Okay, so looks good. Yes, your materials look good. They're easy to read, all except for that one slide with the satellite dish on it. That was kind of difficult to read. Okay, do have some spelling and grammar errors that need to go back. And then try to think about some way that you can promote engagement and discussion based on the class. Maybe there's some sort of activity you can do with them, or something along those lines. So that is where we are. So, all right, guys, looks good. Thank you so much for your hard work.